Go.
John.
I'm John, and tonight I want answers about medical cosmetic spas. There's no stopping us now because we're live.
John wants answers. John wants answers. Give John answers. Give John answers. John wants answers. John wants answers. Give John answers now.
Check your calendar. If it says April 9th, 2015, then we're live. And it's my dad's birthday, so wish the guy with my name happy birthday. My guest tonight is Jennylyn Gleave. Hi, Jennylyn.
Hi, John.
Welcome to the John Wants Answers broadcast. You might know, avid viewers, that Jennylyn is a member of our crew usually, but today she's on camera.
In the hot seat.
And she's the host of the Jennylyn Show, also on this station, KMVT. And she's on the show tonight because she's the co-owner of a new medical cosmetic spa. So we're going to learn all about that. We're going to take your tweets. So during the show, you can tweet us at John Wants Answer. There's no S on the end because the S is for suck, and we don't. Tweet us, and we'll read your tweets, and we'll talk about them. And if you hate Twitter, like I do, you can instead go to our website, johnwantsanswers.com. There's an S there. Go to the contact page, and then send us a message. And we will read that at the same time we read the tweets. The opinions stated here are my own, not necessarily those of my company. All right, and this show can be made without the support of our executive producers, who did not support us last month. Maybe in the future, they will support us. So we'll find out next month if we could have made the show without them. So let's get to it. Our first topic, medical cosmetic spas. Do you hear it?
I see it.
You see it.
I see it.
I can't see
I
it.
hear it.
I can only see the bright lights.
I
Yep.
saw it.
We keep a piano player up there in the ceiling a little bit.
It fit really nicely up there.
So Jennylyn, you have embarked on a new business, a medical cosmetic spa.
Right.
What's a medical cosmetic spa?
It's a spa with a medical aspect to it, as in treatments that are received at this clinic have to do with medical products like fillers. A really popular one is Botox.
Right.
And there's Dysport, it's like Coke and Pepsi. They do the same thing, as well as lots of other fillers. You can actually have a facelift without undergoing knives, with very little or no downtime.
I don't like downtime.
Well,
This face has to get around.
Right. So a lot of times, if you have a facelift, then you have to have plastic surgery. If you don't go down the road of what we're doing in a medical spa. And when you do that, your skin is cut, so you have bruising, you have swelling, you have bleeding. So it takes a very long recovery period, as well as it leaves scars. But when you go to a medical spa, where they're offering the products that we're offering at Eternal Beauty Skin and Laser, you leave, nobody, a lot of times, can go back to work. No one can tell that you've had anything done.
So you can come in during your lunch hour, and you can sit there, have these things done. After lunch is over, go back to work. No one's any wiser.
No one's any wiser.
Except you look better.
Oh, they'll think, did she go home and take a long nap?
Wow.
Because you do look rested. And
Went to Starbucks and got some caffeine and pepped up maybe.
exactly. It depends on what you have. If you have Botox, when you leave, or you have Dysport, because they're the same, I said, they're like Coke and Pepsi. When you leave, nobody will see, because that takes 2 to 3 days before you actually start seeing the results.
Okay.
But a lot of the other products, as soon as they're injected, you can see the difference. And sometimes there's just a little bit of redness depending on how you respond to injections. Some people bruise, I'm one of them. And others, nobody can tell. You just look different, but it's so subtle that no one can really tell what the difference is.
But it's different enough that you will
Yeah,
look
you
better,
just look
you'll
better.
be more confident.
Your muscles smooth out. And a lot of times people they fixate on the common complaint I hear with people that I've seen over the years of being in an industry. People point here. Oh, it's suddenly I got really deep here. Or they will point to their glabellas or their crow's feet. Because the glabellas are the muscles that are in this area. And then they lose the elasticity and then they get wrinkled. Looks like you're constantly frowning. Well, that you can treat with Botox. And after 3 days, it smooths out. And then this one, which is where most people fixate, you can treat with different fillers. Okay. And so the way we treat people is not by addressing this, is by fixing up here. Because what's happening is people are losing the support that you have naturally up here as you age. And so the muscles just start drooping, and it causes that. So then we fill in through here, and it's supposed to lift here, and that will remove these. Sometimes... So
your face is more full, so it stretches the skin tighter.
Yes, it tightens it back up, and it replaces what has been lost that's causing all of that drooping. And in addition to that, sometimes it's so deep that you still have to put some fillers in here, and there are products that you can use to fill those areas. But at our clinic, we are going for a natural look. We don't want people looking like a balloon, all poofed up. I've seen people like that, and I'm sure you've seen some celebrities. They don't even look like themselves anymore. I think sometimes it's because they've been given too much products.
Too much.
So you end up looking poofy. In through here, they look like they got stung and swollen. We're not going to be doing that.
So you mentioned something called crow's feet. What are crow's feet?
Crow's feet are the lines that some people have. You can't see it on me because I have Botox right now.
Oh.
So
they're lines.
Those little fine lines that form like wrinkles around the side of your eyes. And a lot of times people who don't wear sunglasses when they're in the sun will naturally squint. And so that will cause the glabellas to, I mean, it's going to happen anyway as you get older. But if you don't wear sunglasses and you squint, or you have a natural tendency to frown, you will have those lines sooner than later. And so this area is called the glabellas, and you can put Botox here, as well as you can put Botox on the crow's feet, and it just smooths it out. Like when you were a kid, maybe not quite, but it takes those lines away.
Okay, what if I have lines under my eyes? What are those called? Do they have a name?
Those can also be treated with, like I can see them on you now.
Wait, what?
You're not someone who's so caught up with how you look that you don't see it, but since we've opened our clinic, that's the one complaint I've heard every day. People are coming in and they're complaining about these lines under the eyes here. A lot of people don't like injecting there, but now there are different fillers that can be used to fill that in. And you have to have someone who really knows what they're doing for more than one reason.
Right. Because you want anyone near your eyes with needles.
Right.
That sounds scary.
Years ago, when I first got into this industry, they were not using Botox in this area of the face because it paralyzes the muscle, or it replaces the elasticity. But sometimes when you inject there, people who didn't know what they were doing can prevent you from being able to drink a cup of coffee because you lose that movement. But now they've perfected the art of injecting Botox. So it can be administered in this area. But again, it has to be somebody who's very trained and knows what they're doing.
When I come back from the dentist sometimes, I feel like I can't drink coffee.
Right.
Because it runs
because
down my
you're
face.
numb.
Numb, yeah.
Yes, well, it's a similar type of effect.
So if you do it wrong, you're numb all the time.
Yeah.
So for wrinkles, you were talking, there is Botox and Dysport, which are, I guess, called botulism. Is that what it's called?
Well, it's made from that. It's the same product that, yeah, it is called that. They give much larger doses of that to kids who have MS and to people who have problems with sweating. You can use Botox if you have excessive sweating. And if you're someone who is older or whatever, but you have incontinence, they're also using Botox now to treat incontinence. So when people hear botulism, they think, oh, I don't want that in my face because it's a poison. And that's why I'm mentioning it, because it's not a poison that will cause you harm, because they give you so little doses, so little, the dosage to to treat those areas is so small that there's no way it will poison you, or the FDA wouldn't approve it.
Right.
But that's a constant conversation I hear. Oh, that's putting poison in your face, or you're freezing your face. Those are not truths.
Right.
It is a form of a toxin, but it doesn't hurt you, and the dose is that even if you put a large dose in your face, it still wouldn't kill you.
Okay. I'm not worried about being killed.
Well, some people are worried about that, so that's why I'm saying that. They do think that if they put it in their face, that somehow they'll end up dying because it's poisonous.
Now, you mentioned that this can also reduce sweating. So tell me about that.
Excessive sweating.
Excessive sweating.
Again, when you use Botox, what you're doing is you're helping the body to do, in our clinic, we're not doing that as yet, and I don't want to misinform anybody. I couldn't tell you exactly the anatomy of how the whole thing works, but it works. People who have excessive sweating, where you can see them wet under their arms,
We've all seen
they
people
come
like
in
that.
and they can be given it. I've worked in clinics before where they've given them injections under there and it goes away.
Oh.
The only thing is Botox works at the most 3 to 4 months in people. So it would have to be a repetitive treatment that you'd have to go in to get every 3 to 4 months.
So if you have it for sweating or even for your face, you'd have to get it done.
Yes,
Periodically.
yes, it only lasts 3 to 4 months. Some people say 5 months. Younger people, I've heard some say up to 6 months it worked, but you will know when it has expired because you will see the lines come back.
All right.
It's addicting.
Yeah. So in addition to wrinkles, I read here that medical cosmetic spas can help with to correct sun damage on your face.
Yes.
So what kind of things can you fix on my face? Let's say I didn't wear enough, sunscreen as I should have growing up, or even now.
Yes.
What kind of things can you fix?
There are a different number of ways to treat sun damage. You can use products. We have lots of product lines that have helped with those types of issues. We have Obagi and skin.
First, what does sun damage look like? If I have sun damage, what does it mean? My face is
It
discolored?
shows up
or?
in different ways. You could have really dry, unhealthy looking skin. You can have marks on your skin. The common complaint that people have with sun damage is the skin does not have a nice, soft, subtle look. It looks kind of dry and leathery. You've seen people who've been in the sun too much. It doesn't have that natural glow, and you can see the damage. Sometimes it's visible.
Right.
So there is a machine that we don't have at our clinic yet, but some of the reps had it at the grand opening. And I think, were you one of those people who had your picture taken?
I was at your grand opening. I had a picture taken, and it took 3 pictures. And one looked just like me, and then one had some kind of filters on it to show all the damage.
Were you surprised?
Bubbling under the, yeah.
Yes, because most people, because they can't see it on the surface, assume that they have none. Just about everyone has some form of sun damage. But in some people, it's very bad because the skin is so dry that even if you try to treat it with products to help, the surface of the skin is so damaged that they don't get the absorption that they should when they use the products. So some of the ways they treat it, the common way, is by using some of the skincare products, as well as you could use lasers. The skincare products that we use, there's one called Obagi, and you go through a phase of peeling, and the whole point of it is to peel off the exterior or the dermis, so you can remove the dead skin. And then it's a maintenance, it's a package, it's a skincare line that you use throughout the year. In the very beginning stages, you go through more of an intense peeling, and then after that, it's just a maintenance, but you have to continue using it, and a lot of sunblock. You should never leave your house without sunblock, even in the winter time when it's raining and pouring outside, because you can still get damage from the lights.
We don't get that here, raining and pouring.
No, but even if I lived in a place where it rained and poured, I would still put on a good sunblock. I've never left my house without sunblock.
So what kind of things can you do with lasers to fix sun damage?
We have a laser called the IPL machine. It's intense pulse light. And what it will do is it will burn off that surface of the skin, and then it peels off. And after which you can maybe, sometimes a person needs more than one treatment. And then in addition to that, you're put on a skincare regimen. One of the consultants in our clinic, probably our esthetician, would be the person to really get the person on the right line of products depending on their damage and the type of skin that they have. So there are lots of, a lot that goes into treating somebody. You can't just general treatment for everyone. Everybody is different.
Right.
So you have to specialize the care depending on what the person's condition and needs are.
Okay. So now I understand you also have lasers for your hair, for hair removal. So how does that work?
So your hair has different growth cycles. Your hair has an anagen, a catagen, and a telogen.
It's a lot of gens.
Yeah, but those are the 3 phases of hair growth. And so in order to destroy your hair, the hair follicle has to be present. And that's only present in the anagen phase of hair growth. So because you can never determine which cycle of the growth the hair is in, and it's never in the same cycle at the same time, we recommend 5 treatments. And so we figure if you get 20% of hairs in each treatment, then over the course of 5 treatments, you should get 90% reduction. We never promise anybody 100% because some hairs just don't respond to the light. And the way it works is the laser targets pigmentation. So if you're a very blonde person, laser hair removal might be difficult for you because when you put the laser on the skin, you always have to shave first because if you don't, you can burn the person. And if you're very dark, then it also, you have to be careful because the laser is not intelligent enough to differentiate between skin and hair, and it will just burn you. So certain people just aren't candidates with some lasers for this procedure. So before a procedure, when you get to the area you want a laser, you shave it. And then when you put the laser on that spot, the hair follicle is still present in the top of the skin, and it grabs the light and acts as a conductor. The color in the hair will grab the light and then drag it to the root and burn it. So after each treatment, all the hair will fall off. But only the hairs in the anagen growth phase will not return. And that's how you eliminate it.
Okay. So I have hairs on my earlobe sometimes, which I hate, but they're blonde, so I can't really get rid of those, can I?
Are you sure they're blonde?
Can you see them? Are they not blonde?
Well, it looks like you trimmed them.
I trim them as much as I can, yeah.
So it's hard for me to see now, but I would have to see it. And then with those hairs, even though you may have 3, you may still need 5 treatments because we don't know which growth phase it is.
So I have to shave every day my face. It'd be nice not having to shave. But I'm worried that styles will change. And then like in 5 years, beards will be all the rage. And I'll look like, you know, an idiot not having a beard. Nobody else does.
So is that why you won't want it lasered?
Well, if I get lasered though, then it won't stop growing, right? How long will it stop growing
if you eliminate it, like I got lasered 10 years ago and the hairs have never returned. Now, as you get older, your hormones, they create different changes in your body and sometimes they stimulate new hair growth. So you'll get new hair growth, but it doesn't mean the hair has come back. Once it's been destroyed, it's gone. It doesn't come back. But if you see hair at the site, it's new hair. It's not regrowth. So if you laser your beard off, I'm sure as you become an older man, you'll see a few straggly hairs coming in.
Right.
And so you'll have those unless you want to laser those as well.
Right, okay. What, you can remove hair off any part of the body?
Yes.
Not just the
Any
face?
part.
Any part, like the back?
You'd be surprised how many men come in to laser their privates. It seems to be the favorite part for men.
More men than ladies?
I would say equal amounts of. A lot of women want to do Brazilian, bikini, you know.
How people's backs? Do you get a lot of that?
A lot of very hairy men want to do their backs and their chests. In a previous job, we ran we ran a hairy chest contest. And we did it on the radio. And the person who had the hairiest chest, we were going to laser for free. And I literally saw a chest that looked like a sweater. I swear, I'm like, I did a double take when I could not believe anybody could have such thick hair growth that you could not see any skin at all. And it came up the hair like a carpet.
And was that the winner?
I felt really bad. Yes, of course he won.
All right.
But our nurse wasn't happy.
We have to stop for a break now. When we come back, we're going to learn more about medical cosmetic spas. So see you in a minute. Okay. So we have a break. Let's see. Do we have any tweets?
No one tweets.
You don't think anyone tweets?
Maybe they tweeted and said, oh, can we book appointments? That'd be nice.
Sure, you should have an appointment booker over Twitter.
Nothing there. No. Let me check my emails. Did I get an email from the website?
They're all chill. They're all chill. Do you have a cat in the clinic?
Do we have the cat in the clinic?
You should get a cat. You should get a cat for your clinic. Like a mascot.
Okay.
We're going to laser it.
No, we want
We're going
to
laser hair
stuff.
remove it. It's going to be a bald cat.
And the cat should have the logo lasered out on each side of the cat. I'm just saying, if you laser your logo in the side of a cat, or just stray cats, just get stray cats.
Just find the cats.
Laser the logo, let them go.
You know, there's a bunch of feral cats in the
back of our
mall
clinic.
behind our, in our building. Beside the Staples.
Yeah. I want to get a big teddy bear for the patients who are scared so they can hug it.
Think of the advertising. Yeah.
Okay, we need to do some promos while we're on break. So, are you ready? Let's see. Hello, Newport, Virginia. You're watching John Juan's Answers on the station that never sleeps, KKRP. I just made that up. I don't think they are KKRP.
I don't think they are. And
Newport.
trust me, they do sleep.
Wait, did I say Virginia?
Yes, that's what you said.
Let's try that
Weren't you
again.
supposed to say Virginia?
Vermont. Sorry, it's Vermont. Let's try it again.
Yeah.
All right.
Hello, Newport, Vermont. And you're watching John Juan's Answers on the station that sometimes sleeps. Okay.
He
It's
misses calling.
a new syndicator
Should have been a
this
comedian.
month. So we got them a little promo. Okay. We did that. All right.
Three, two.
Welcome back. And I'm here with Jennylyn Gleave, the owner of a medical cosmetic spa. We're talking about different things you can do at a medical cosmetic spa near you. Yours is in Cupertino, right?
It is.
All right. Acne scarring. As a teenager, I had plenty of acne.
Really?
I had a beard of zits, the kids often would tell me. Because kids are mean.
How did your face get so smooth? Most people have evidence forever.
Yeah, I got out of it. I know when I got into my university years, it all cleared up.
You're lucky.
I am lucky. But when you get older, it clears up, right? So, so if you have really bad acne, you get scarring. And what does that look like?
Well, you see people, they look like they have pits in their faces. I mean, I don't want to sound unkind, but usually that's what you see with someone who's had it. And we offer something in our clinic called Microneedling, and that can treat the scarring that's been left back from.
And how does that work?
They take, it looks like a pen, and the head of the pen has like about 30 very, very fine needles. And it's, a good example would be like rototilling soil, like if you're going to plant a crop. And seriously, that's what you do with all these needles. And it looks red, and you may get a little bit of bleeding, and then you kind of blot it, and you put a solution on it. It's like a stem cell solution, and that promotes new skin growth.
Right.
And that's really a good way to treat the scarring and to give you a new look that doesn't have as much evidence of the fact that you had acne. It requires more than one treatment. Some people 3, some people 5, but that works.
Would you want to get this done on a Friday so you have all weekend to recover?
People do it and go back to work.
Really? After all that bleeding on the
Well,
face?
we blot it off and you give it a little bit time to cool down, to calm down, and then, you know, the face looks a little bit red, but you can still go back to work after. And then we also have a machine called a Dermasweep. And this is it's similar to, it is a microderm machine, but it's like a much more advanced because it treats at a much deeper layer of the skin. And it comes with a stem cell solution that's administered by a second-hand piece after you've done the rototillin. And that too promotes new skin growth. And so a lot of the technology on the market now is like when you're planting, you dig up the soil and then you put on the seeds and then you leave it to grow.
All right. Now, I have heard that Botox and Dysport can also help with migraines.
Yes, a lot of hospitals and doctors' offices are using that. But in our clinic, we are not going to be doing that because it's more medical.
Okay.
Yeah, so people don't come to us for medical problems. They just come to us for help with cosmetic issues.
Okay.
So they do use it, and that is true, except not at Eternal Beauty.
Now, we talked about laser hair removal, but there's also other methods, like there's waxing.
Yes.
Do you provide waxing too?
We provide waxing for patients who really want it, but if you're a patient who wants to do laser hair removal, you cannot wax. And you'd have to stop waxing for 6 months before we can laser you.
Oh, wow,
because
6 months.
you have to allow the follicle, the hair follicle, to come back in. Otherwise, you're wasting your money. Because we'll laser you till doomsday, but we won't get your root because it's missing.
Right.
So that's why we ask patients who were waxing, who want to be lasered, to stop at least 6 months before we laser them. Another thing is if you are going to do laser hair removal, you want to avoid the sun. So some people, we advise them not to do it in the summer if they're going to be out in the sun a lot because of hypo or hyperpigmentation.
Right.
And this is caused because the skin has become light sensitive.
Now, you have a machine called the JuvaShape. What does that do?
It's a machine that does body sculpting. Like it can do a lot of different things, and it's a new machine and it's new to me, and it can do a lot more than I'm saying here right now. Maybe we should do a follow-up show when I've had more experience with it. But if you have loose skin, it's like for tightening up. We call it the body reshaping machine. So if you are unhappy with like your neck, if you have too much saggy skin or your face, it tightens up and it sucks out the fat and then melts it, and then you drink a lot of water and it gets back into the bloodstream, and then eventually you pass it out.
And it's good for people who've lost weight recently, right?
Yes, and if you use this machine, you have to drink a lot of water because what they're doing is they're burning off the fat, and the nurse or the technician will tell you, drink as much water as you can.
Water's good.
Yeah.
Yeah.
And so it comes with many different attachments. So I think that a later date, you may want to invite our doctor to speak more in depth
Okay.
to some of these machines that we have.
So your clinic is full of medical professionals,
Yes.
like doctors and...
Yeah, we have a doctor. We're going to have a nurse practitioner. We have 3 part-time nurses. We have an esthetician and a receptionist.
And these are all licensed professionals, not just
We
people
will
off the
not
street.
hire anybody who was not licensed. It's not worth it to take the risk.
Wow. I'm being told that we're running out of time. Where can people go for more information about your clinic?
They can go to eternalbeautyskinandlaser.com and check it out.
All right.
Because anything I didn't answer, you will find the answer there.
Whoa. I'm under fire. I need some laser treatments for my ear now. Can you help with gunshot wounds? Our next episode is May 14th. Stay tuned for Atlas of Thoughts on His Net coming up after this. And then a show called What the Bleep. Hey, I wonder if I'm on that show, because I appear on that show a lot. Well, thanks so much for coming,
I
Jennylyn.
know you love me, Keith.
Great show.